All right, welcome to another episode of Medicine Mondays, your number one show if you are overwhelmed by the healthcare system and even worse, underappreciated by the healthcare system, looking for a voice of reason. I am yours truly, Dr. Pierre, your favorite board certified internist. Today, we're going to be talking about just the aspect of being overwhelmed by the system. And this is definitely a thought that I've been kind of really just been dealing with, especially over this past really 2+ years when we've been dealing with a worldwide global pandemic and we've been seeing just issues after issues occur, whether it be supply and demand, whether it be physician, and really more importantly, just healthcare workforce burnout, because that discussion obviously gets talked about a lot. But more importantly, I want to pivot it. I want to talk about, well, what are the patients experiencing? Because I think a lot of times, especially in healthcare, we talk a lot about what the workers are experiencing. We talk a lot about what the system is experiencing. But for some reason, we never seem to really include, hey, a part of that system, and more importantly, a huge part of that system are the patients who are really making the system kind of go round and round. So I'm going to be kind of just discussing, my thoughts on really this topic in general and kind of really just kind of honing in on obviously the message with Medicine Mondays. And if you're my Lunch Learner, Dr. Barry podcast listeners, that as well too, kind of the reason why I like doing what I do on a week-to-week basis. So I just came back from vacation. Now, I say vacation because and it's weird because as a physician, I'm not a good vacationer. My wife will tell you I don't really vacation well. So even though I take a week off of doing the medical related stuff in terms of, seeing patients in the hospital and the rehab centers, I go to a business conference. Like that's kind of my way of taking a vacation, more importantly, taking a break from it all. And it's so funny that when I come back after a week, it takes me almost like 24 hours to kind of jog my memory back. It was like riding a bike, but kind of jog like, all right, what are my passwords? What do I do here? And that is how sometimes overwhelming the system can be just on a regular healthcare worker who loves what they do. So imagine the scenario for healthcare workers who don't really love what they do, and there's a lot of them, or who are feeling overwhelmed by a system, who are feeling underappreciated by a system. Imagine what they have to go in on a day-to-day basis, and how would you think that would impact care? Like just think about that. Like if you're going to a system, again, you're the patient, you're going to a system where you're not feeling your best, you're not feeling ill, let's say you're at your bottom, and you're relying on a workforce that also is being overwhelmed and underappreciated, bad things can happen. And unfortunately, if the bad things can happen, the patients are the ones who are going to take the hit. So I want to make sure, like, especially having that discussion with that alignment, we kind of understand, why, people like me, people like content creators like myself, get on platforms and really learn and focus on trying to educate how to make our patients empowered to go into these healthcare systems, to understand what questions they need to ask and what answers they should expect back based on the questions they need to ask. And again, I'm now a decade, almost, yeah, I started medical school. I started medical school in 2011. Got out, graduated 2007, graduated in 2011. So I'm a decade and a year, some change out of medical school. And I'm still young in the game. I'm not even 40 yet. I'm still young in the game, but I'm watching just my patients, whether they're outpatient, when I was doing outpatient medicine, whether they're patients I'm taking care of in acute care setting, when I was at my acute care hospitals, where patients I'm taking care of in the long-term acute care setting, or even patients in the rehab, I'm seeing patients at different levels having to experience different processes that either affect them positively or negatively. One thing I always tell my patients, especially when I know they're having a bad day and they want to apologize for it, say, hey, you do not have to apologize for having a bad day. I understand that when I go to work, you know what, you're especially if you're in the hospital, you don't want to be here. No one wants to be in a hospital. So I understand that you're going to have those days where you're just not feeling yourself, right? So it's never a bother for me. But when I think about just this aspect, and especially we kind of get to the main theme of today's discussion, when I think about this aspect of being overwhelmed by the healthcare system and how is that a detriment to the patients, what typically occurs? If you are a person who's like, you know what, yeah, I got high blood pressure. So I got family members who have high blood pressure. But if I go to a doctor, like say I go to Dr. Barry, and all of a sudden, and now I walk in, I'm not taking any medications. And now he's telling me I need to take one or two medications, or I need to see another physician specialist because the blood pressure that I didn't feel any different before I walked into the office is damaging my kidneys, damaging my lungs. Just the thought of that is going to be so overwhelming that guess what I'm going to do? I'm going to avoid that completely. And this is what happens on a day-to-day basis. You have people who are so overwhelmed by the thought of our system that they avoid us completely. Then you have those who are like, you know what, I have no choice. I have to experience the system. Let's say I have high blood pressure. Let's say I have high cholesterol. Let's say I have diabetes, my sugar's uncontrolled. So I'm forced to deal with a healthcare system that when I'm in it, the doctors, don't understand how to speak at a level that I understand. Let's say the nursing staff, let's say the clinical administrators, they're having a bad day, so they take it out on me. And if everyone's taking it out on me, or I'm going into a situation where like I walk in clueless and I walk out clueless, guess what? I am also overwhelmed. So that's more stress on me. That's more chances of being non-compliant with my medications because I didn't even understand that the doctor wanted me to take my medications every single day. Let me tell you a story. When I was doing outpatient medicine, especially when I first got out, because I got out of residency, I did outpatient medicine for about 3 years. Yeah, about 3 years. And quite often, I would talk to my patients for 10, 15, 20 minutes, get at to their level. And before they would leave, I would say, okay, tell me what you understand. And more importantly, tell me what you don't understand about what I just talked about. You would be surprised how many people say, Doc, I'll be honest. I don't know what you just told me right now, but if you're telling me, I'll do. And that is a reality for a lot of people. When I talk to my other physician colleagues, they say the same things. That they could be talking to their patients for 5-10 minutes. They could have the best bedside manner, on this side of town. But after they're done doing their spill and educating their patients on, why they need to do one thing or the other, the patients are still kind of confused. Patients are still left clueless. And because they feel overwhelmed with the information that is being thrown at them, they completely shut down. It's the reason why when I was doing outpatient medicine, I started doing my lunch and learns because I said, you know what? I know I just threw a lot at you, just talking about blood pressure. I threw a lot at you. Guess what? I also did a video on my website. Go to my website, watch that video as well. And if you have any questions, ask your questions there. Just wait till you come see me. Because I knew that, again, I'm trained for this. Years of training to understand about high blood pressure, years of training to understand about cholesterol and the effects of diabetes, the effects of kidney disease. I have years of training in that. I do not expect you to be able to walk in to my office and after 10, 15, 20 minutes of speaking to me, understand what I have years of training of. But I think what happens, especially as physicians and healthcare workers, we go in expecting our patients to just understand all of the directions, all of the health education that we're giving them in like a 10-minute span. Like we actually, and then we put the blame on them when they can't follow the directions because they just did not understand. They just did not understand. Hey, you know what? I just got a bag full of medications here, and I was told to see 2 or 3 different specialists. I didn't even know what a specialist was until I walked in here. Now I got to see like 2 or 3 of them. Yeah, I'm just not going to do this. And ultimately, like I mentioned early in the beginning, ultimately, guess who fails, right? Guess who takes the brunt of the hit? It's the patient. Is the patient who has to now, because they don't understand the medications, their blood pressure runs amok. It's the patient who has to, maybe they don't understand that they were supposed to see one doctor, they end up seeing another, right? So now there's an additional cost to them because they become so overwhelmed with the system and they shut it down. They say, you know what, I'm just not going to going. And then now 6 months, a year and a half later, a disease that may have been in its early stages is at a much more advanced stage. And sometimes the treatment that you could have gave in the beginning doesn't even work anymore. I said countless of times, I've told this story before. I had my male patient who walked in again, same typical story, had avoided the healthcare system for as long as he could until his family brought him in there. He was on no medications because he was quote unquote healthy. How many of y'all are watching this or listening to this have family members who are quote unquote healthy, even though they've never seen a doctor in years? Like that happens a lot, unfortunately. So he's quote unquote healthy. I do what I do. I talk, I listen, I run some tests. Hey, guess what? You're not quote unquote healthy. Now he's leaving with 3 different medications. Now he has to see the kidney specialist because he's almost on dialysis. And I'm sad because I know, man, if I could have gotten to this guy 3 years ago and given him one pill that they give away at Publix, they literally give away blood pressure medications at Publix. They literally give away, or I'm regional, so Publix is a grocery store in South Florida, or just the southern region. They give away medications for diabetes, like medications that I know if I could have just give it to him here, he wouldn't be talking about having to be on dialysis because he was that close. Like, oh yeah, you're not doing good. You're about to be on dialysis, and that is how scary it is. So as the healthcare professional, I have to understand that the onus of taking away some of that burden on my patient is on me. It's not on the patient. We can, especially as a healthcare worker, we cannot expect our patients to like deal with the overwhelming stress of our healthcare system that we put upon them. We can't expect our patients to deal with the overwhelming stress of their disease that's put upon them. We can't expect them to deal with all of that. Like we have to be there to help them lift some of that burden up and help them move it along. Like that's really our job. That's really our goal. I say this all the time. I am an educator through and through, whether I'm educating residents, medical students, or patients, or even other physicians. I'm an educator through and through. And the reason why I love to educate, because when you're educated, you help relieve some of that stress and burden of unknowing. You help relieve some of that stress and say, hey, I don't really understand what's going on here. And I don't like this feeling of not understanding what's going on. So I'm just going to avoid that feeling. No one wants that feeling. If you could ask your most typical type A person, no one wants the feeling of not knowing what they're doing or not understanding what they're doing. So it's imperative. It is imperative on us, physicians, nurses, healthcare staff, administrators. It's imperative on us if we want to like uphold this system and not let it crumble. Like we have to take care of our patients. Our patients have to be the number one priority. And yes, I understand that you're going to have times like pandemics where a disease may cause undue stress on us. And yes, I understand that you're going to have administrative things like insurance companies and hospitals and, put all of the burden on us. Yes, I 100% understand that. Like, and again, this is not the episode to say that like us healthcare workers aren't experiencing it, because we have a phrase for it. It's called burnout. Like, so this is not that episode. This is the episode that I want to make sure that we are not overlooking our patients in this kind of global sphere of the system, because the system is heavy, right? The system can be overwhelming. The system can be very underappreciative. As again, the motto of this show. I say it all the time. I like to say it. It is the number one show, right? If you're overwhelmed by the healthcare system, if you feel underappreciated by the healthcare system, and you're just looking for a voice of reason, I'm here. right? And my goal is to continue to be that voice of reason, not only educating you with all of our amazing guests to come on the show, or even when I'm doing my solo episodes, but to kind of educate the community as a whole. So again, I just wanted to hit on that soapbox because I felt it was needed, especially just coming out of, every I feel like every time I come from a vacation, then I have to come back to the system. I realize like, oh yeah, this system's kind of heavy. Like, this system isn't something to play with. So every time I do a vacation or something like that, I feel like I gotta like re-energize our fan base of the Lunch and Learn community. Or if you're a Medicine Monday watcher, thank you. Shout out to my YouTube family as well. Like always, remember to subscribe to the podcast. Make sure to subscribe to our YouTube channel. And I'm gonna see you guys next week.